Well, hi there, Dr. Darrow.
Hey, Nita Valens, how are you today?
I'm great. How are you?
I'm living it up.
Well, that's a good thing. That's a very good thing. We want all our listeners to live it up, too. So you know what we're going to do today?
Have fun?
We're going to have fun, and we're going to teach our listeners how to live pain-free. So if you're listening and you have musculoskeletal pain, which is pain in the neck, the back, the knees, the elbows, any kind of pain, arthritis pain that is muscle pain or joint pain or related to holding up the structures of the body, and you've suffered with this pain for a long time, then you need to give us a call at 866-870-5752. 866-870-5752. That's our number to call in and talk live with Dr. Darrow right here, right now. And when you call the program, you also get today a free book, Dr. Darrow's latest, and it is called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's got 264 studies actually about why this treatment works, how it works, etc. And we want you to take away the free book, and we want you to call the program. And remember, we are here Saturdays at 10 a.m. and again at 1 p.m., but it's better if you call now. The show is only an hour long, and every week, Dr. Darrow, at the end of the program, we end up with people on hold, and the program's over, and we don't want to disappoint our listeners. So call early in the program.
I love it.
And I love it too. So also you can go to the website, which is www.lastemcells.com. That's lastemcells.com. You can email Dr. Darrow off of every page on the site and see him performing the treatments on video. And also, if you want an e-copy of the book, you can email Dr. Darrow off of every page on the site and request your e-book. How about that?
I got it all set up for you.
That's totally awesome. So I bet you have a million emails coming in.
How did you know that?
I actually tried to email you this morning just to give you a laugh.
That's so funny. Well, here's one on a knee I'm looking at on the computer.
Perfect.
And obviously we do tons and tons of knees every day. But we also do, shoulders and backs and necks, toes and fingers, hips. There's nothing really I don't inject. The body is made out of collagen, and that's the stuff that we can assist in stimulating the growth of. So if you have any kind of musculoskeletal pain, I'm not talking about if you have cancer or some disease. I don't treat those. I don't do IV stem cells. I only do injections into the areas where we're trying to grow back some tissue. So if you have something like that, please give us a call right now at 866-870-5752, 866-870-5752. I would like to talk to you, and like Nita said, by the end of every show, we have a ton of people waiting to talk to me, and they can't because you're too late. So try to call in now if you can. Anyway, what this person said is, "Hi there. I suffered an ACL, MCL meniscus injury in January 2018. I received an ACL reconstruction. ACL is the anterior cruciate ligament. It's a ligament that holds the two joints, the joint bones together, the tibia and the femur. I received the patellar graft, and I'm still having considerable pain and instability. Gee, I wonder why." I added that.
Yeah, I'm sure.
There was an incident where I think I stretched it myself. Well, many of these fail. I get people in all the time who have ACL reconstructions, and then they come back because they stretched it out or retore it. Then he says, is it a he? Actually, I don't know by this name. I'm not going to say the name. It might be a she. "I have seen doctors since who acknowledge that my graft seems slightly loose, while also acknowledging I may have a meniscus tear. My main question is if prolotherapy would work to make my LCA graft more dense. The answer to that is yes. But the other part of the answer is prolotherapy, although there's studies showing it can tighten up an ACL from, my God, probably 25, 30 years ago. The newer studies with the newer technologies using platelets from your own blood, which is a simple process. We just draw your blood from your arm, what we call the antecubital fossa right here. By the way, Nita, I'm pointing on a video camera right here.
Ah.
Or taking your own bone marrow, which we get from the pelvis. It's not the hip. People say you're going to take that from my hip. Nope, not from the hip, but people call that their hip. It is the back of the pelvis, and it's called the PSIS, if you want to look it up, the posterior superior iliac spine. And we do take bone marrow from there. We spin it down, and then we inject it into the knee, and then it can also thicken up the ACL. So yes, these new techniques do help amazingly well and much better than the old prolotherapy. How do I know? Because I did the old prolotherapy on my knee many times after my little man Dakota, the 9-year-old husky who weighs about 80 pounds, hit me full speed on the lateral side of my knee and loosened it up along with the meniscus and the MCL, that's the medial collateral ligament, and it was called O'Donoghue's terrible triad. When you get hit from the lateral or outside of the knee, it really can damage the knee terribly. Anyway, I injected my knee about a dozen times with prolotherapy, and it helped, but it didn't work. Every time I tried to run, it would loosen up again. I then did PRP, and in 1.5 days or so, that knee was tightened up. It was like magic. Since then, I have done umbilical stem cells. That's another form of stem cells that I use. And I've done it on both my knees, and I've done the umbilical cord stem cells on both my shoulders with amazing success. And my shoulders are pretty darn good. I'm showing people in the video. I can do sports again and lift weights and play golf.
And golf?
Yeah. Well, golf is something that's a little bit of an addiction these days. So
that's your number one sport, right?
You might see me out there today at Mountain Gate Country Club. It's where I've been playing for years. I also love Rancho Park, which is a public course not far away, where they used to play the U.S. Open. And Arnold Palmer, I think it was, got something like a 15 on the 18th hole. There's a plaque there. I didn't even get a 15.
Wow.
So,
I will.
Oh, no. High is bad.
Oh.
I'm going to have to take you out to play sometime, Nita, and teach you the game.
Yeah, I have to learn this because everybody's playing except me.
Let me finish up this question.
Okay.
From reading online, and I caution people, when you read online, you're most likely reading about stuff from people that have no idea what they are doing, including doctors who don't know what they are doing. I'm sorry, doctors are not always the brightest people on the planet. We think they are, but we're getting more information these days showing that doctors are just humans and they can make mistakes too. So you get a lot of stuff online from people that don't do a lot of this kind of work, which we call regenerative medicine. I always tell people when they ask for a referral, they say, who should I go to? I go to the doctor who does the most. He's the guy that knows the most. What you're typically reading about online is from people that don't do that much. They may have gone to a weekend seminar, they may do a little bit, but they don't do very much. So be very, very careful. Anyway, what this person says is from reading online, it seems stem cells or PRP would not be the case, although they may help with meniscus. I am just a little more concerned with instability. The best treatment we have is using platelets and cord, that's umbilical cord stem cells. How do I know that? because we have a giant study we're doing in our office on bone marrow stem cells versus umbilical cord stem cells. And I don't care what you read on the internet, there are guys out there that say the umbilical cord stem cells are dead. Of course, they are guys who only do bone marrow. I do them both. And I've done thousands of them. And done them for many, many, many years. I've been doing regenerative medicine probably longer than anybody you know of, over 20 years. There are some people longer, but I don't think they do as much as I do. I think I've been told I do the most of anybody on the planet. But at any rate, we have found so far, our statistics show that cord blood stem cells, that's umbilical cord stem cells, mixed with your own PRP, are more effective than your bone marrow stem cells. They both work great. They're pretty much tied with the cord blood winning by several points. Now that doesn't mean you shouldn't do bone marrow. Bone marrow works great. There are people that we can't do the umbilical cord cells for one reason or another. And there are people we can't do bone marrow for one reason or another. So we got to check you out. And actually I have an email that just came in this morning, and it's very long and complex about an ACL rupture, and the person said, can you help me? And,
oh, wow.
and he said, tell me over the internet, email me. And the answer is always the same. I need to examine you. I don't really care what your MRI says. The MRIs, as we know, Nita, there are studies that are done actually in my book, in this book that you'll get a copy of by calling in right now. And please call in to 866-870-5752, 866-870-5752. And just by calling in, we'll give you a free copy of the book. Or if you want to call my office, you can call there too. I'll give you that number, get your pens. It's 800-300-9300. 800-300-9300. And if you have some sort of insurance, we probably take it, which will get you at least your first visit. We do take Medicare, Cigna, Aetna, Blue Cross, Blue Shield, United Healthcare, and we can help you get Care Credit, which is a credit card for insurance, for people that don't have insurance for medical procedures. So I hope that answers this question. Let me see what's going on here with you, Nita.
Well, while you're checking out that next question, why don't I just remind our wonderful listeners that the hour goes by quickly, and I would love to hear from you at 1-866-870-5752. That's 866-870-5752. That's the number to call and talk directly to Dr. Darrow right now. Now imagine that you talk to Dr. Darrow and you get some guidance and information, and then you can make a better decision, especially if you're about to roll into an elective surgery. This is critically important for your health and for your future, because surgeries are invasive. Go to the website, see the treatments that Dr. Darrow is performing on video at www.lastemcells.com. That's lastemcells.com. So your knee pain, your elbow pain, your back pain, your neck pain, your hip pain, your toe pain, your wrist pain, your finger pain, trigger finger, all these things, any kind of musculoskeletal pain, this is what Dr. Darrow specializes in. And this is the latest, innovative, cutting-edge treatments. That's my editorial for the day.
I love it. So here's another question. This one's on back pain. And, it's interesting. I don't know the percentage, but probably at least a third of the people that come see me, I get about 80 new patients a month, at least a third of them are ready to have a orthopedic surgical procedure. Hip replacement, knee replacement, meniscal tear, blah, 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 rotator cuff tear in the shoulders, neck surgery, back surgery. And most of them never needed it in the beginning. Very, very, very few patients who see me end up getting surgery. It's rare. There are a few people that fight me and go get the surgery, and then often they come back saying, I shouldn't have done it, I'm worse than I was before the surgery. I can still help many people after they have a failed surgery. So if you've had a surgery and you don't like the results, feel free to still come in. What is a failed surgery? It's simple. It's a surgery that didn't work. And there are so many of them in the orthopedic realm that it's literally hysterical. I don't know why people even do them anymore. I don't even know why surgeons are doing these orthopedic procedures. Yes, if you have a broken bone, get right to the orthopedic surgeon. See what he needs to do. If your leg is numb or something like that, yes, check it out. But at the same time, if it is not an emergency, please consider doing regenerative medicine and growing back the tissue instead of doing something that is not going to make you feel better, that is not conservative and is invasive and can leave you with years and years of misery. The insurance companies have diagnostic codes for failed surgeries. That means there are so many of them that they are forced to make up a diagnostic code. You'll see things like failed back syndrome. That means a surgery was done and it didn't work. There's way too many of these. The day will come, I hope it's during my lifetime, when we look back and we say, why did we ever allow these surgeries to be done? They never should have been done. Because the paradigm is shifting. People are regenerating their tissue. More and more doctors are learning how to do this. My bet is that every doctor will be trained in stem cells in medical school in a few years. There are now programs being set up in regenerative medicine. So don't be fooled by old cultures. Don't be one of the sheep. Humans tend to be sheep. Nita, you know about that from a psychological point of view. What's that all about?
Oh, absolutely. Well, it's about some people feeling hopeless or victimized or depressed, excuse me, and not feeling like they have options, feeling like they're the victim of whatever is exterior to them. It could be a car accident or something congenital that they've just had so much physical pain and they don't know where to turn. So with everybody talking about elective surgeries, they end up in that. And as you just said, that's not a high success rate.
So this question goes on to say, I was referred to you from my good friend, I won't say the name. His wife went to you. I have lower back issue near the L4 and L5 area. Can you help with stem cells for my back? So, the answer to this is the answer I give everybody. I need to touch the area first. My fingers are my MRI. I know that sounds stupid, but it's the truth. I don't need an MRI of your low back or your neck to know if I can help you heal. Why? Because we know the MRIs and the X-rays can give us false information about what's going on. 2 reasons. Number 1, they don't show the truth, meaning they're overly sensitive and they may show, let's say, a herniated disc when there isn't even one there. An MRI can show an ACL rupture, and then a surgeon goes in and lo and behold, the ACL is intact. So that's one reason. They're overly sensitive. The other is they may show an anatomical deficiency that is not the pain generator. For example, I get people all the time with herniated discs. They don't have leg pain, they have back pain. And then I touch the back and I tell them this is not from a herniated disc. This is from a ligament that's been sprained in your back, and we can heal that very easily using platelets from your blood or your bone marrow for stem cells, or platelets and umbilical cord stem cells. There's a lot of ways to skin the cat. So we get very, very high healing rates. I'd say about 80% of people that come to us that we treat get better. There's always a few people who do not get better, either because they didn't follow my instructions. That's the number one reason. Sometimes people will come in once and say it didn't work. Sometimes they will spread out their treatments too far, That's another common thing. I tell them, come in every 2 weeks if you can. We want to keep the inflammation that we create going. We don't want you to get a treatment and then go out and get frustrated and do your sports or do your gardening or whatever it is. We want you to take off a period of time to let things heal. If you look at my Yelp reviews, and I hope you do, you could just go to yelp.com and put in my name, Marc, M-A-R-C, Darrow, D-A-R-R-O-W-M-D. You're going to see a few very nasty Yelp reviews. I am not allowed to comment because of HIPAA, which is a privacy, exactly what took place in the office. But every single one of them, there is a reason for the failure of the work that I do. And it's not my failure, it's the patient's failure. But I can't, and the patients don't call me. I ask them to call me back so I can help them. They don't. Some people are strange. That's another psychological thing, right, Nita?
Yes. Well, I was also going to just let people know that HIPAA is the Health Insurance Portability and Accountability Act of 1996, which protects a patient's privacy and security and safeguards medical information. So that renders us helpless if somebody's complaining, because we can't respond ethically or legally.
Yeah,
the thing to know is
crazy.
that it's crazy, but the thing to know is if Dr. Darrow gives you instructions and you abandon treatment, you don't complete treatment, or you don't follow the instructions, then guess what? That's on you. That's not on you, Dr. Darrow. That's on the patient.
The issue that's so strange is people can complain online. That stays there forever. But we cannot say what really happened as a doctor.
Exactly. Which, it's completely unfair, but, the fair is in
life.
Pomona. We'll just carry on. Our number is 1-866-870-5752, 866-870-5752. The hour is flying by. Please call now so you can speak to Dr. Darrow about where your pain is and what's going on. And also, we're almost halfway through the show. Shall we say a word about other things going on in the office?
Yeah, my beautiful wife, Michelle Darrow, does the vampire facelift. She's a nurse practitioner, which is using the same cells that I use on your body to grow tissue. She does it on the face to make people look younger. It's an amazing procedure. She also does all different types of aesthetics on the face. She also stimulates hair to grow on the top of the head using cells. The other thing that I like to talk about is the diet that we use in the office, which is really a ketogenic diet. That's the buzzword today, which is called ideal protein. So if you come in and you've got back pain and you got a big tummy, guess what I'm going to have you do? I'm going to put you on a diet. Now, if you can cut your carbs out and do it yourself, God bless you, go do it. But most people cannot. That gets real boring. So we have a diet called Ideal Protein. We use it for people with back pain and knee pain and lower extremity pain, foot pain. And please don't get mad at me if I suggest it. I always tell people I'm going to talk about something. If you don't like the subject matter, tell me to shut up, and I will. But it's to your advantage to lose weight for many, many health reasons. The only way we know to extend life is by low-calorie intake. I know that's crazy. You can't believe it, but it's true. Also, we know that there's studies that show that if you are overweight, that causes knee arthritis. So you want me to fix your arthritis? Help me out. Lose the weight.
And how about that formula if you're overweight 10 pounds, which, 10 pounds is not a lot. A lot of people are overweight much more. And then we have obesity, which is 30 pounds plus. But 10 pounds is 40 extra pounds on the knees. So here's the thing. You're listening to Living Pain-Free with Dr. Marc Darrow. And we're halfway through the show. Please call us at 866-870-5752. Grab a pen, write down this important information about to come your way. I'm your host, Nita Valens. We'll be right back.